Campaign is calling for new blood donors in England and Wales following a 40% drop in new volunteers in the past decade. No one's entirely sure what's to blame for the massive drop, but the NHS believes one of the main reasons is the increasing pressure on people's free time. They mention longer commutes and the distractions of social media. How depressing is that? But there are some people who want to give blood and they can't. Gay rights campaigners are calling for an end to the restriction on sexually active gay men from giving blood. Under the current rules, gay men who've had sex in the last 12 months are not allowed to, and you'll know there's a whole history there. That's not the only reason you might mind not being able to be a donor. For example, if you're on a hospital waiting list, if you've had a tattoo in the last 6 months, if you've had any serious medical conditions, you can't donate blood either. So are there too many restrictions in place? Is it time to relax the rules on who can give blood? Maybe you're a gay man who tried to give blood and you were surprised when you were turned away. Or are the risks, do you think, just too high of allowing this? Well, I mentioned our producer who went to give blood. She is Katie Gunning and she's back with us, I'm pleased to say.
Here I am sporting my large plaster.
I can see that. And how was it?
Yeah, it was, the whole experience was all right. It's rare. You turn up to an NHS clinic, it's not often that you arrive and the first thing they say to you is, thank you for coming. And then they're very friendly. And I didn't have an appointment. I'd gone on the website and put in my details, and it had told me there were no appointments, but I could just turn up. So I went around the corner, turned up, and then you're given a form to fill out, which is a lot of these questions, which I can come back to in a moment. And then the whole process of the blood is taken.
How much do they take? Yeah.
I apparently have about 8 in my body, and they
8
take
litres.
8 pints.
8 pints.
And they took about 1. And now it's going to wing its way up to somewhere in North London and be looked after.
So funny that the last thing to go metric is the blood donation service.
Yes, and maybe it's just because we're better at visualising that as a... I actually am not good with blood. I mean, I don't... The whole visualising the blood and watching it come out, I struggle with that slightly. I worked very hard not to watch the blood come out of my arm.
Yeah.
But it's very hard not to see everyone else's sort of gently swaying in their plastic bags.
But it's the normal thing of just a little needle. Is it?
Yes, the needle is much like having a blood test taken or an injection. It's no more painful than that. And then you sit there for about 10 minutes while this machine works away at taking the blood out of you, and that doesn't hurt. If, like me, you struggle with the idea of it, then I kind of had to keep moving and thinking and trying not to think too hard about the blood. But it's not painful in any way, and wasn't too much of a surprise.
And did you have any sense of the crisis there? The idea that, thank goodness you've come, Katie, because nobody's coming anymore? Well,
no, I didn't, but that's because they'd had seemingly an almost instant effect at the clinic on Margaret Street round the corner with people. They said that they were busier than they would normally be on a Friday morning because people have read about it in the papers. And many of those people will be a bit like me. They've probably given blood before in their lives. I think I gave it more than a decade ago. And then you suddenly think, oh, right, so I turned up. Now I think some of it is that people have forgotten that to fit it into their lives, to realise that it is something that they can do. And the questions that you're asked are not in any way off-putting. It's a large page of questions that ask everything for whether you've tested positive for HIV, if you've ever injected yourself, but some of them are quite specific, and it makes you realise that some of these things are more common now. So on that list, it asked me if I'd ever injected myself with illegal or non-prescribed drugs, but it also asked if I'd ever injected myself with bodybuilding or anything cosmetic, and of course that's
Botox.
Increased. Botox, that would rule you out.
And you said no to all of that?
I said no to all of that. And then it also, in another one, it was asked me in the last 12 months if I'd experienced any body piercing, tattoos or acupuncture. And again, those are things that people do more nowadays. So
there's quite a lot of restrictions there.
There are quite a lot of restrictions. Then there's a whole section on sex, about who you might have had sex with in the last 12 months that could rule you out. So as a female, if I had had sex with a man who might have had sex with another man, that would rule me out.
Did you were asked that question?
That's on the list.
Well,
yeah.
Did you have sex with a man who might have...
If I had sex with a man who's had sex with another man,
right,
then it's a no.
Okay.
And if
you didn't have to say, look, hang on, I've got to make some calls.
No, I didn't. I was a clear set of no's, except for travelling to France.
Okay. So anyway, you passed the test and you gave the blood, and you don't get paid, do you?
No, you don't get
cup
paid.
of tea though.
You get, in fact, yeah, you have to drink a lot of water. You drink about a pint before they even take it, and then more water afterwards. There's crisps and biscuits. I didn't get tea actually because I was considered a bit because I was still feeling wobbly. I had to drink water.
Did you? Because I gave it once, like you, about 15 years ago. It was digestives. Can I ask about the biscuits?
The biscuits. There was a selection of biscuits. There was, I think, some ginger nuts and some digestives, and even actually a couple of chocolate, type penguin type biscuits.
Okay, I'm getting down there.
And crisps.
After the show, I'm going down. Thank you very much, Katie. Very unusual for people to make that kind of sacrifice on the show. Well, it wasn't. That was a good public service thing.
No, it
will
wasn't.
You do it again?
I think I will now do it again.
I'm going to do it.
Having left it such a long time.
All right, well, we're going to talk in a second, thank you, to the Assistant Director for the whole transfusion or blood and transplant service. But before we do that, let's go back to this angle of gay men not being able to give blood if they've had sex in the last 12 months. And this surprised Jack Jordan, who is gay and who wanted to give blood, didn't you, Jack?
I did, yeah.
And tell us about the experience then.
Well, when I was 18 and became eligible of age to donate blood, I proudly went on the NHS website and began to sign up to be able to donate blood, and then I got to the restrictions on homosexual men and found out that I can't give blood if I have a sex life, like every other human.
Yeah, and that surprised you?
Yeah, absolutely. I mean, it means that a heterosexual man or woman can have casual, unprotected sex and still give blood, but a gay man like myself, who's in a monogamous same-sex relationship, can't give blood, even though I haven't got HIV or any other contagious diseases.
The historic reason for it is to do with, I guess, in the 80s, where the whole AIDS panic started, it was, and they made very rapid associations with groups who were most vulnerable. Among them were, for example, people who use shared needles for injecting heroin, but also sexually active gay men. That was a fact back then. I don't know how much of a fact it is now.
I know. I mean, it is still a fact, and it's also a fact that heterosexual couples can also, they're at the same risk. So it's basically, if you have sex with someone who has HIV, you are at risk of getting that. So, I mean, there are statistics that say, yes, more gay men are likely to be HIV positive than heterosexuals. But, I mean, it's literally by a margin of 52% gay men and 46% heterosexual.
Yes, but now, hang on. That's because there are more heterosexual men around. That's the statistic per... If you look at infections per gay man or per heterosexual man, it's still largely in that group, sadly, isn't it? But anyway, regardless of that, you feel that that's not fair because they can screen the blood anyway.
I mean, they screen the blood anyway. So if the blood tests on the donations aren't effective enough or strict enough for people's reassurance, then, that's the NHS's job to review and perfect the process rather than exclude healthy gay men, like myself, from donating blood, which I'd really like to do.
Well, it's a very good point, because you say you are HIV negative, and you obviously know that. And if you have you don't want to have to do your own blood test to prove that, but if you've got a piece of paper that says that, you wouldn't think there would be any reason why they could say no.
Absolutely.
So what are you going to do, Jack?
Well, I'm not going to be abstinent for 12 months. I don't think my boyfriend would like that. So I will be, if there's a petition going to say, let's change this rule so gay men who don't have HIV can give blood, I will happily sign it. And I'll happily give blood when I can.
Thanks so much for talking to us, Jack. All the best to you.
Brilliant, thank you.
There we are, Jack Jordan, who's 22 years old. Not many 22-year-olds giving blood, and John Latham is sitting opposite me, the Assistant Director for the NHS Blood and Transplant Service. Leaving aside the issue of sexuality there, it's great that he wants to help out, isn't it?
It is, and good afternoon, Jeremy.
Good afternoon.
And I know this is a very contentious issue, and unfortunately it's an issue based upon scientific evidence, which I'm available to be able to talk that through. But you're quite right, it's that age group that we really want to attract more of. And the statistic that we've released today about there being a 40% drop in new donors coming forward in the last 10 years is a sign that we do need to change people's attitude at that age group to get them to come forward.
So to be clear, on the issue of gay men who are sexually active giving blood, that is not your policy, is that right? You've been told to basically carry that through.
That is the policy based on scientific findings. I'm not in a position to be able to tell you what those scientific findings are, because I'm not a clinician. But,
and I was going by history rather than by anything at the moment. But we asked the Department of Health why it is the policy, and they gave us a statement saying our main priority is that blood is safe. The first criteria is the safety and quality of blood. A committee of experts advise on blood safety. It's driven by a need to protect both the donors and recipients. blood must be the safest it can possibly be. So somewhere there is a committee of experts who've decided that sexually active gay men are risky for blood transfusions.
That would seem to be the position, and obviously we just apply the policy as a service.
So are you able to put some pressure on the other things in the list to say, well, hang on, we've got too many restrictions here?
Well, you call them restrictions. Our duty of care is to ensure that we have safe blood, both from the patient's perspective, but we also take the blood safely from a donor's perspective. And though what you call restrictions are things in there that make that happen. And
well, someone who's had a tattoo, it doesn't sound too worrying.
Trouble with tattoos, you will have penetrated the skin with a needle, and you may well then carry an infection from the tattoo that's taken place.
But not HIV. I mean, there's very few cases of people getting HIV from a tattoo. It could be
hepatitis. It could be other types of disease. The fact that you've penetrated the skin makes it more likely that you may carry something that we wouldn't want to pass on onto the blood supply.
And if any member of your family has suffered with what is called mad cow disease or CJD, again, that's one you can't allow.
We can't allow. I mean, our duty of care is to just make sure that the blood that we give is secure. And we also wouldn't want to take blood from donors who, at the end of the day, we wouldn't be able to use because it's not secure. So it is a balancing act, and what we don't need to do is get more people coming forward who are eligible to give blood for them to see the reason why they should do.
Well, fire away. Give us your message on why it's important, because we've obviously forgotten it as a society.
Well, I don't think we've necessarily forgotten it, just things have got in the way. So as a society, we've got more pressures on us, we've got less time to do these wonderful things. Our message is, please make time. It's very important. Every unit of blood that you give us will save and improve the lives of up to 3 people. And it's an hour of your time. I think your producer has just pointed out it's not exactly difficult to do.
Well, she said the biscuits are getting better as well.
Biscuits may well be getting better, but certainly, hopefully, the service is certainly getting better. And we will, we look after our new donors when they come in, try and give them the best service we can. It's best if you do make an appointment. We've got an online booking service that you can look at all the appointments available and book one that's convenient for you. And then when you go in, it shouldn't take more than an hour. And our team, if you're a new donor or perhaps someone coming back like yourself after many years, we'll make sure you have a very good experience. I'm going to, as a promise, I'll
do it. And in fact, funny enough, the place that Katie went to, it jarred in my mind because that place has been open for decades.
It has.
It's quite a famous one.
And it's been refurbished as well, Jeremy, since you last seen it, so it'll be an even better experience.
Last question for you. Help us understand, why is the average 23-year-old not thinking about giving blood in the way that they did 30 years ago?
I think what's happening is there are things getting in the way. I think life's also getting in the way. And if you look at the use of the internet, we spend an awful lot of time online, which is good because it's a very good way of us communicating. But we actually need people to move offline once they've actually signed up and actually come down the high street and make that donation. So it's linking together, those two things.
Thank you very much, Steve. John Latham, Assistant Director for the NHS Blood and Transplant Service. Couple of things in here. Not as many people signing on to give blood in their 20s, but also men who are gay thinking, wait, why are you excluding us? 0500 288 291. BBC Music Day, we're going to talk about learning an instrument late in life. Meanwhile, we are discussing blood transplants or transfusions, giving blood, and the idea that they've got all these restrictions, and maybe that's why people aren't doing it now. 22-year-olds aren't giving blood. Michael Rigby says, this is amazing, talking about restrictions in other parts of the world. In Germany, if you were somebody who lived in the UK during the BSE crisis, you can't give blood. That's how tough they are. So that would basically be the whole of this country, essentially. Ron Copsey says, as a gay man, I have been refused the chance to donate blood. It's against my human rights. It denies a whole section of the population the chance to contribute. It's a really difficult one, isn't it? Because obviously there has been a change in behaviour in the gay community since AIDS broke out there and was very focused there in the 80s. And also they can screen for it better. But I guess there are all the memories of infected blood and haemophiliacs dying and so on. Billy Bragg is in Dundee. Hi, Billy.
Hiya.
Now, wait a minute. You're not the Bragg, are you?
No, no.
No, okay,
no,
sorry.
Definitely not.
All right, I could tell the second you spoke. So you've been a haemophiliac?
I am a haemophiliac, born with haemophilia. That doesn't go away, Jeremy. You're born and you die with it.
Yeah. And Scotland was a particular cluster of bad blood in the 80s, wasn't it?
Yes. Well, late 70s, early 80s, there was the health minister at the time thought it would be a good idea to buy blood from prisons in America.
Yeah, that's a great idea.
Also, I just found out today some prisoners in Scotland as well. So, but the prisoners, Jeremy, were infected with hepatitis C before they even knew it was called hepatitis C. It was called non-A, non-B hepatitis before it was called hepatitis C. But why would they buy blood from prisoners? I mean, it's just a crazy notion, isn't it?
Yeah, well, I think what happened, Billy, was that in the States they paid for blood, and as the result of that was, and not diminishing those who gave, but a lot of people who were in difficult circumstances, homeless people particularly, were queuing up at blood banks to give blood and get some money.
Yep.
And that's fine until you get a virus in the system, which then gets sold on and used by you. I mean, that's the problem, isn't it?
Yeah, I mean, obviously, most of the prisoners, I would think most of the prisoners would have been infected with HIV, hepatitis A, B, maybe even A and B, but certainly hepatitis C before it was called hepatitis C. Yeah, they were spreading it, giving the blood. The British health minister at the time bought the blood in, and we were given it. No chance at all. We just got intravenously.
Okay, so you've got hepatitis C, is that right? And what's that done to you?
Well, it attacks the liver. It's make you very, very, very drowsy all the time. You don't want to do anything. I mean, it takes me to go and hoover my house now. It's just a horrible disease. It's horrible. Mm-hmm. It's night sweat. It's a lot of sweating, but I've apparently got the infection, apparently, but I'm left with something else. I'm not sure. It's doctor talk, I don't know exactly what they mean,
Yeah.
But, there's definitely something there.
So is it your thought that these restrictions should stay in place?
Well, yeah, I do. And I honestly believe, I'm certainly no homophobic, but I believe if someone is infected with hepatitis C, they should be. If people want to give blood, I think they should be given a simple blood test and checked for HIV and hepatitis C.
Thank you very much indeed, Billy Bragg in Dundee. It's really, really awful illness, hepatitis C. And carried in the blood, of course. Robert Fletcher in Spalding, Lincolnshire says, when I go to give blood, I don't see enough young people. I think that's why there's a shortage. Yep, that's right. Richard Ashton in Holsworthy says, I've given 50 times, but none of my family have recently, purely because it is not as convenient as it used to be. There have been cutbacks, so there are less staff. I'm definitely going to go and do it. Why don't we meet and do it together one day? Because it just feels like the right thing to do. And I suppose partly maybe do they need less blood? Are there less violent accidents, car crashes and stuff going on? Is that part of the change here? Matthew Harris in Northampton says, I was given blood contaminated with hepatitis C. I think blood donation has been given a bad reputation by cases like mine. But I don't see why sexually active men should be banned from giving blood, because the screening process should work. Sue Ripley in Stockport, you are a blood donor, Sue.
Yes, I am.
And you had transfusions as a baby.
Yes, I did. I was a rhesus negative baby, so my blood sort of interacted with my mum's blood. So without 3 exchange transfusions as a neonate, I wouldn't be here now.
And that's why you're committed to it?
Yes.
And tell us about the experience now. Do you go in, you get the biscuits, are you treated well?
Yes. I can go to any of my kind of local areas, and it's really easy to access. I just phone up, make an appointment. You can't just walk in off the streets. You used to be able to just bob in and say, have you got a slot? But now you do need to make appointments. But it's easy access for me to go to Manchester. And I'm also on a research study to see what an ideal time for the gap between giving blood is. It used to be 6 months, and they're trying to, they often bring people in after 4 months to see if their body's recovered enough to increase the overall donations.
It's interesting
so I'm part of that research anyway.
Yeah, the nice guy from the blood and transplant service, I said to him you will have heard why people aren't in their early 20s aren't coming, and the biggest part of his answer was that they're all online on social media and they're living on their computers. And what do we make of that?
I think that there are so many other demands on young people's time, and not just time to kind of, like do social media and all of that, but also to be doing charity events. You can't blink without seeing a charity event somewhere, and which isn't a bad thing. Whatever helps people in a particular situation, or animals, or overseas, that is fine. And I think that's a different mindset to when I first started donating blood in the late 70s. So I don't think people aren't giving anything; they're just not giving blood. And also, there are generally less transfusions given overall nowadays, so people aren't exposed. People don't know anybody who's had blood, really. Although we're demanding it, it is sort of less given generally. So it's kind of a double-edged sword, really. We give less, but we still need a certain amount for emergencies.
You obviously know a lot about it. Ian Hale in Farnham Common, Buckinghamshire, says, I answered all the questions honestly, but I had a heart scare, so they wouldn't take my blood. Gary in Stirling says, I'm gay, they won't let me. Do you think, Sue, that they have got too many rules?
No, not at all, because, and it's a shame for people in relationships, because you could have a lady who's kind of had several partners and they're not screened for as quite as much as actively gay men are, but there is a higher risk with the actual practice, so, of how people would develop HIV and because of the intimacy within that relationship. So I think the blood transfusion service in the UK is probably one of the safest in the world, but obviously we've just heard about Germany. And I'm a children's nurse, and in the late 80s I was looking after a young boy. He was only about 12 or 13, and he, like your previous caller, had received infected blood products, haemophiliac, received infected blood products from America, and he had to tell me, just be extra careful because, I'm HIV positive, which nobody should have to be saying that. Certainly, not certainly a 13-year-old to a healthcare professional or anybody.
That's very, very sad. Thank you, Sue.
Okay,
Take care.
Then, bye-bye.
Bye-bye.